drops back. As you pull it back, it just stops there. And I'll show you with my computer. Now, there's different ones. Some are different frequencies. It's picking up different frequencies. I know that one. This one. Okay. I'll switch this off then now. Okay, everyone. Some essential minerals. I'm going to talk today about 4 essential minerals. Obviously, there are more minerals, but these are just ones that I just want to share with you. And the first one we're going to talk about today is iodine. Now, iodine has a history of use, discovered in 1811, used in 1834 to treat goiter. Around the early 1950s, it was erroneously taught that it could be toxic to the thyroid if more than 2 milligrams was consumed daily. Today, the average daily consumption of iodine is about 0.138 milligrams per person. Now, let's look where iodine is stored in the body. We know that. How many people know where iodine is stored? A lot of the women know it's in the thyroid. But it is also stored in the salivary glands, cerebrospinal fluid, and the brain, membrane enclosing the fetus and afterbirth, breasts, ovaries, and the clear fluid that fills the front of the eyes. Now, we're going to talk about some minerals that inhibit thyroid function. Okay, these are receptor sites in the there are receptor sites in the thyroid, among other places, that capture iodine. So if exposed to a halide, which is a mineral, the body will not hold on to iodine but excrete it. Now, what are some of these halides? One is called bromine, which is found in many breads, which is, how often have you read along the list of breads, dough conditioner? What is a dough conditioner? Well, it's found in cakes, biscuits, bakery products, pesticides, soft drinks, some toothpastes and mouthwashes, some hair dyes, some perms, some preservative in cosmetics, seat and armrests, door trims in your car, fire retardants in fabrics, flavoured vegetable oils. An unrefined salt helps with the removal of bromine. So we don't want to get anything with bromine in it. Other halides, we've got fluoride, which you know we can get from lots of different places, but obviously the most common one is your town water supplies, but it's also get it in toothpaste. And by the way, if you're using fluoride toothpaste, throw it out. Get yourself some herbal toothpaste. You need to use herbal toothpaste. Chlorine and perchlorate, which is found in some car bags. So what happens if you had, and some goitrogens also inhibit and compete with iodine uptake, so you need to watch it. If you are very sensitive, sometimes you've got worry about too many vegetables from the cabbage family, so you've got to watch for your cabbage, kale, cauliflower, broccoli, and all those. But lots of these food need to be eaten, but if you are very sensitive, you need to watch for these. So people with low thyroid need to watch these because it may be the tipping point with them. But now let's look at some health benefits of iodine. It controls your metabolic rate, okay, which, as you said, includes absorption of food, sleep cycles, influences heart rate, blood pressure, body weight and temperature, boosts energy levels, gives you healthy nails, hair and teeth. It's needed for reproductive system, boosts your immune system and strength, and it's great for hypothyroidism or underactive thyroid. But it's also good for overactive thyroid gland. Both hyper and hypothyroidism may be caused by thyroid issues that iodine may treat, prevent, and even reverse. chronic fatigue, fibromyalgia, fibrocystic breast diseases stems from iodine deficiency. Now, Dr. David Brownstein found that he's an iodine guru. He's a doctor from America, and he treats loads. And I've got his book called Iodine, and it is excellent. Dr. David Brownstein found that iodine helps decrease insulin needs in diabetics when they use 50 to 100 milligrams a day. Cancer prevention. Studies have shown that cancer cells shrink after being injected with iodine. Breast and thyroid cancer patients have low iodine levels. Regulates estrogen, which in turn affects infertility and miscarriages. So you need to be watching that. It reduces mucus catarrh in sinuses and intestines. It cleanses and detoxifies lymph that acts as a vacuum cleaner in the blood and helps lungs. According to Dr. David Brownstein, is more powerful an antioxidant than vitamin C and E, and has anti-tumor and anti-atherosclerotic activity. But it makes us smarter. And that's why they look for, when women have pregnant, the doctors will do an iodine test on them to see how much the iodine, because they know if you're low in iodine, you will lose a lot of your brain IQ. It destroys pathogens, molds, fungi, parasites, and more, and it's the most powerful antibiotic we have. And guess what? It's not patentable. Do you know, when I remember going on to we were looking in an old army museum, and we were looking at what the troops was in the Boer War. You know, even before the First World War, we went back to the Boer War, and we were looking to what the supplies that the soldiers had. And do you know what they had? Some iodine. They had a little tube of iodine that they could break and they could put over whatever injury they had. This is something they had years ago, but nowadays they tell you it's no good. You know, be careful of iodine. Okay, it destroys pathogens, molds, fungi, parasites, and more. It's the most powerful antibiotic we have. Okay, it prevents heart disease, which is like your arrhythmia. Ensures the apoptosis or the programmed cell death. Okay, and if you have a lack of it, you can have dry skin, trouble concentrating, constipation, cramps, and leg swelling. So there's lots of things that we worry about when we got low iodine. Iodine flushes toxic chemical. Thyroid and your goiter disappears. And over 100 years ago, it was shown that goiter can be reversed by giving iodine. See, iodine pushes your fluoride out of your thyroid and pineal gland as well as other tissues. It kills viruses and bacteria. Okay, signs of hyper or underactive thyroid. Constipation, you can see them there. Female infertility, abnormal menstrual cycles, anemia, low heart rate, brain fog, cold hands or feet. You know something, I've suffered for this all my life. I didn't know that it was a low iodine deficiency. And so really most people need to up their iodine levels. More signs, impaired memory, insomnia, whatever, intolerance to cold, irritability, decreased sweating, depression, difficulty swallowing, muscle cramps and joint pain, decreased libido in men. So you've got a lot of signs. But this is an interesting one. Thinning of the outer third part of the eyebrows. So if you've got thin eyebrows and out there you've lost the hair on there, guess what? You're iodine deficient. Really interesting, because this doctor, I was listening to this doctor, he says he can't help noticing when he goes around, he looks at women and he sees, and men too, the outer third of their eyebrow disappears. They lose it. That's a sign of iodine deficiency. Tingling in your hands and feet, weight gain, yellowing of skin due to impaired conversion of beta-carotene to vitamin A, hair loss or thinning. So if you've got hair loss or thinning, dry, coarse hair, nervousness, poor muscle tone, rapid thoughts, shortness of breath, sluggish reflexes, and thin, brittle fingernails. Now, what sort of iodine can you get? There's different forms that you can go. Go to your chemist and you can buy Lugol's iodine, which you can use. There's nothing wrong with use it, but a stronger form is nascent iodine, which I've got, but it's a lot dearer. It's probably 3 or 4 times as dearer than Lugol's. Okay, it's a consumable form of iodine that holds an electromagnetic charge. It allows for larger release of energy once consumed and is very similar to the precursor form of iodine that is converted to thyroid hormones. It may take a healthy patient 3 to 6 months to reach saturation point. Those with cancer, 3 to 4 years. So some people are very, very chronically deficient in iodine. How to do a self-test for iodine deficiency? Paint a 5 centimetre circle of iodine on your soft skin, so on your stomach or on the inside of your arms or inside of your thighs, and see how long it takes to disappear. If the stain disappears less than 5 hours, you're extremely deficient. Less than 10 hours, probably deficient. Less than 24 hours, you may be deficient. And if it stays there after, or lightly slightens after 24, slightly lightens after 24 hours, then your levels are considered normal. I tell you what, I paint mine on, it just disappears so quickly. So we know that most of us would be iodine deficient. And that's what Dr. David Brownstein said. Most people are iodine deficient. You can repeat this test every couple of weeks to see whether your iodine dose can be reduced. And you can actually put it directly on any tissue transdermally. You can use a swab or applying it liberally to genitals areas or the perineal area as an adjunct to oral dosing. Now, where do you get it from? From a lot of chemists. Not all chemists have it. Okay, and he suggests that we can take 2 to 6 drops a day, but don't take too much, be careful. But for many years this has been considered safely as a treatment, and many diseases has been caused no problems. And I've had classes, and there's some old people in the classes, I remember back when my mother and father always used to give us iodine for everything. So just remember, and by the way, if you go into a chemist and you say, can I have a bottle of iodine, they'll normally ask you, what are you using it for? Do you find that? Yeah, they do. They ask you, what are you using it for? I don't. Well, you just got to work it out. Be ready for an answer, because you have to often give an answer. And I think to myself, what do they need to know? You don't need to know what. Why are you buying something? What do you need to know for? So just be ready for that. Okay, magnesium. True, none of your business. Okay. Magnesium. Now, this is a really important magnesium. Now, this is from Dr. Carolyn Dean, is a medical doctor and naturopath. She has co-authored and co-authored over 35 books, including The Magnesium Miracle. Look, I found so much interesting information in here. But do you know, with magnesium, 60 to 65% is in your skeleton teeth. Only 1% is in your blood. So if you go and have a blood test for magnesium, you're going to find out that it doesn't register. So it's not accurate. But yet we need it. We need it for every organ in our body. We need it for energy, for protein, all the enzymes. It's absolutely essential for our body. But what about heart health? How important? And those of you who are nurses here know how important it is when it's used in the emergency room intensive care for cardiac patients. So you need magnesium. And often if you call the ambulance officers will inject magnesium if somebody's having a heart attack. Magnesium straight in the heart. Magnesium chloride is the most flexible and useful form of the magnesium because it can be injected, taken orally, or used transdermally, and it's used for heart health. And usually when people say, oh, look, what can I do for arrhythmia? Well, there's a few things you can do for arrhythmia, but one most important thing is up your magnesium, and especially if you're going through stress. Do you know, recently, last year, when I was going through all the stress with Peter's sickness and his death, my magnesium levels dropped dramatically. I had to up them credibly. And if I forgot one day, occasionally I'd forget, and immediately I would go into cramps. My body would cramp, and I'm thinking, I've got to really increase my magnesium levels. So that's what I did, because stress uses up magnesium rapidly. So if you're under stress, make sure you increase your magnesium. It affects your heart rate, your blood pressure, vascular constriction, and muscle contraction. And anybody who has got blood pressure problems needs to be watching their magnesium levels. Depression is related to magnesium deficiency. So serotonin, the feel-good hormone, requires magnesium in its delicate balance. The body does not retain magnesium well. You sweat it out very quickly, and so you need to be replacing it all the time. It can cause neurological dysfunction in the brain, which leads to depression. All your cells need magnesium, whether it's strong bones or teeth, or your hormones, or your cardiovascular or detoxification, your electrical impulses. All of your cells need magnesium. Okay, when excess calcium enters the cells because of the insufficient magnesium, muscle contraction is sustained for too long. And we suffer, for example, twitches and tics in mild cases. I can remember I was visiting a lady who had motor neuron disease, and she was in hospital. She was in early stages of it, but she was in hospital. And she was saying how she was lying there, and she says, oh, I just feel so much cramping in my body. And as she was lying there, I noticed her eyes do a little tick. You know that little tick in your eye? And I saw her eye doing that, and I said to her, you need more magnesium. And she increased her magnesium. See, this is it. People, the doctors and the medical profession wouldn't know that. But she said, I'm in so much pain. I'm cramping all over. So just remember that. Increase somebody's magnesium. When magnesium deficiency becomes chronic, we suffer the symptoms of heart disease such as angina, hypertension, arrhythmia, the spasms and contractions characteristic of asthma, migraine, headache, or painful menstrual cramping can even be just magnesium deficiency. And we'll find out where we get our magnesium from, and you'll realize why people are deficient in it. Restless leg. This is what happens to me, especially as I was saying, when I was going through this stress of a night time. Normally, this cramping will happen when you're in bed, because your muscles are very relaxed, and they've been asleep, you've been asleep, and then all of a sudden you wake up with this cramp in your leg. So you have to be aware of that. I usually have, and I did have, and I still have, a tube of magnesium ointment or salve that you can get from the chemist, and it's excellent because you put that on and you just put the cream on the palm of your hand, you rub it straight into your cramp, and within probably a few seconds it'll go away. Your cramping will go away. And I can remember Peter waking up one night with this really severe cramp, and he said, oh, I'm cramping. And I had to run in and get some magnesium and gave him a dose of magnesium orally. He drank it down, and within probably about 5 seconds, you come out of that cramp. So just remember, you need magnesium to get people coming out of cramps. And they can be very intense. Regulates hypertension if you've got lower blood pressure. Sleep improvement, it's a natural muscle relaxant. If you've got headaches, it also, once again, it relaxes. If you want to go to sleep, just make sure you take magnesium before you go to sleep. if you're low in magnesium, you also can have acne or rosacea. It regulates diabetes because most diabetics are very low in their magnesium and they're unable to properly absorb their sugar from their blood. Your gut health affects absorption. You can have irritable bowel, leaky gut, candida, and other gut disorders. And anti-inflammatory effects. So you can see that it's very, very broad in its way it's going around in your body. Low magnesium take is linked to chronic inflammation. Low blood magnesium leads to high blood sugar, insulin, and triglycerides levels. It improves PMS. And it's also, remember, it has used in anti-cancer. You can see it goes everywhere. Low magnesium triggers many medical conditions. It helps the body detoxify. It creates energy, activates muscles, helps digest proteins. Look, there's so many. I'm not going to read them all out, but you can see them. Always the muscle numbness and tingling, muscle cramps and contractions, seizures, plus all of these things. Now, Dr. Caroline Dean explains, research indicates that ample magnesium will protect brain cells from damaging effects of aluminium, beryllium, cadmium, lead, and mercury and nickel. Do you know, if you are following health, which most of you would be doing it, you'll find that a lot of people have got heavy metal build up in their bodies. Heavy metal. How do you get heavy metals out? Well, can I tell you it by great difficulty? You have to do a heavy metal cleanse, and there's certain ways you've got to do things. But when I'm going through this, I'm seeing in here magnesium actually protects your brain cells from the damage effects of aluminium, beryllium, cadmium, lead, mercury, and nickel. So all of these, they're all working together. And sometimes we miss a simple thing as magnesium. But low levels of brain magnesium contribute to the deposition of heavy metals in the brain. That heralds Parkinson's and Alzheimer's. It appears that the metals compete with magnesium for entry into the brain cells. If magnesium level is low, metals gain access to more readily. There is also competition in the small intestines for the absorption of minerals. If there isn't enough magnesium, aluminium won't be absorbed. Now, what factors influence your magnesium level? Well, we get it from leafy greens. Magnesium is primarily in leafy greens. But you also get some in other vegetables, seeds, tree nuts, whole grains, certain wild-crafted herbs, kelp, and most sea vegetables. And Celtic sea salt also contains a good source. But we also know that you lose it through glyphosate. Now, how many things we're losing because of glyphosate? Cooking and processing, alcohol in excess, sugar, sodium, caffeine, menopause, unhealthy digestive system. So if you're having any of these fake drinks that you can drink, you are losing your magnesium in your body and you won't be healthy. And it's also in a good partnership, calcium and magnesium partnership. A healthy ratio of calcium and magnesium in the diet should be 2 to 1 or 1 to 1. But for many it is 15 to 1 and as much, 5 to 1 and as much as 15 to 1. The balance between calcium and magnesium is very important. And people say, oh, you know what, I need to take more calcium. Which I'm not saying if you're put on calcium, that's fine, that's your call. But often it's got to do with your magnesium. I mean, you must increase your magnesium as well. We need magnesium. Magnesium is necessary to keep calcium in the solution in the body, preventing its inappropriate deposition in soft tissues. So how many people get calcium in their tissues? And you get these lumps and you spurs and you get hardening in your... You can hardly walk. You're going like this. You're walking like this because you've got calcium deposition in your joints, in your tissues. It's not meant to be there. It's meant to be. It's got to be in solution in your body. we have a sufficient hydrochloric acid in our stomachs. We can dissolve certain calcium from the foods we eat. After calcium leaves the acidic environment of the stomach and enters the alkaline environment of the small intestine, it is magnesium that is necessary to keep calcium soluble. Now, what sort of magnesiums do you want? You know, there's magnesium citrate, there's magnesium orotate, there's magnesium chloride, magnesium lactate. Okay, but basically, for the average person, magnesium supplementation is safe to experiment on. Okay, the basic rule is if you take too much magnesium, you'll just get diarrhea, which is for some people could be good. So you can't really overdose on magnesium. But those with renal insufficiency or kidney disease, extremely low heart rate or bowel obstruction, they should avoid the therapy. But most of the population is magnesium depleted. So there's different ones you can get. I actually think, I just go to the health food shop and I just buy I'll show you the brand of it in a minute. What is the difference between this magnesium and magnesium Epsom salts? Well, Epsom salts will help. It helps your muscles, aches and pains. It helps detoxify, and it can be intravenously used, okay, for asthma attacks, onset of myocardial infarction and eclampsia in pregnancy. And you can use it in your bath, but the effects are not lasting because the magnesium sulfate is difficult to assimilate and is rapidly lost in the urine. So you can use it in your bath water. And you can use magnesium chloride flakes. Now, magnesium chloride flakes are dearer, and they're like crystals, and you can use them, and you can, but it is much more easily assimilated and metabolized in the body. You can make your own. You can buy magnesium oil, which is not really oil. It's actually just magnesium chloride, which has been dissolved in water, and it feels a bit oily, but it's not really oil. You rub it on your skin, or your gastrointestinal tract is avoided altogether, and there's no laxative effect. So you can rub this on your skin, and it's ideal. But the only problem is you start doing it, and you got to get used to it, because at first it feels itchy, and you just get a little, don't like that feeling. So it can feel prickle on your skin. But you can use it in sprays, massaging, sports rub, foot bath. I know one of the doctors, he loves it so much, he sprays it inside of his mouth, you know. Do-it-yourself recipe to make your own magnesium oil. So basically you just use magnesium chloride flakes, you put some water, you heat the water up and you heat the chloride flakes, and that's it. Simple. It's just dissolved magnesium chloride. And you can make a magnesium oil recipe, which you can just use some drops of your essential oil. Your side effects, some with low blood pressure, anti-anxiety medication, any sensitive skin, any renal impairment and limited kidney function, and sometimes you're on any prescription drugs, you need to be careful. So here we've got, so these are the things these are the things that are helped if you want to get healthy. The missing link, adding extra magnesium, however, might be the missing nutritional link to help guard us against heart disease, stroke, depression, and osteoporosis, and many other disorders. So where is the best place to find magnesium? In your dark leafy greens, your nuts, seeds, and it's really in dark green vegetables. That's really where we get it. And you stop and think, most people, and especially how many dark green leafy vegetables are they eating in their diet? Virtually none. Sometimes they might have a little bit of salad, and they get that from the iceberg lettuce from the supermarket. What is in there? Okay, the next mineral that we're going to deal with is borax. And this all comes from Dr. Walter Last. He's a research chemist, biochemist, and a toxicologist. With that is a practicing nutritional and a natural therapist. And he was born in Germany and he migrated to New Zealand in 1971, and in Australia. He came to Australia in 1980. Okay, so, but what is borax? Borax is a naturally occurring mineral compound commonly mined from dried salt lakes in California or Turkey. It's naturally mined, so there's no synthetic borax. In solution, borax is strongly alkaline with a pH between 9 and 10. And good diets provide some boron a day, but chemical fertilizers inhibit their uptake. Due to their content of boron, borax and boric acid have basically the same health benefits. So sometimes we interchange those words. But Dr. Rex Newman found an arthritis cure. In the 1960s, he developed an arthritis and he did not know what to do. So he decided he would take some boron. He knew that boron aids calcium metabolism in plants, and he decided to start taking 30 milligrams of borax a day. In 3 weeks, all the pain and the swelling had gone from his stiffness, had gone from his arthritis. He helped some of his patients, even those with rheumatoid arthritis, juvenile arthritis, and lupus. And he found that artificial soil fertilizers in the soil led to low soil boron levels and high arthritis. And he wrote that commonly people can get rid of their pain, swelling, and stiffness in about 1 to 3 months, but will suffer a Herxheimer effect. And that Herxheimer effect means that you're going to feel worse before you feel better. They must persevere, and usually the stiffness is gone in 2 or 3 weeks. It's great for osteoporosis. It's great for your teeth, your bones and your teeth, heart problems, vision imbalance, memory and cognition. Once again, more minerals. Balances the sex hormone, improves your memory and cognition. Especially good for young men who are building bodybuilders. It builds their level of free testosterone, rises by 1/3. It shrinks prostate tumors and PSA levels. Fungi is excellent. It's one of the best things. People say to me, what can I do for candida? Well, this is excellent. So what you do, if you're treating candida, a low to medium weight people use 1/8 of a teaspoon. You do not use much. You only use a tiny little bit. But with heavier weight people, you maybe use 1/4 of a teaspoon per litre of water, and you drink that spaced out during the day. You do it for 4 or 5 days a week, or as long as you can, as long as you need it. So that gets rid or helps fungus problem or candida. So normally candida and fungal infections are harmless as oval yeast cells, but what happens is, but when challenged, cells called hyphae develop, damage the intestinal wall and cause inflammation and leaky gut. Boric acid inhibits the formation of biofilms and also the transformation of harmless yeast cells into invasal hyphal form. So basically, it stops your yeast spreading through your body. So borax is so good. Excellent for psoriasis. Psoriasis seems a lot better after 2 days drinking 1/4 of a teaspoon of borax in a litre of water spaced out during the day. It's great for toenail fungus and athlete's foot. But I actually want to put a mention of it here. If you've got toenail fungus, it's internal. You've got to get inside your body. If you've just got, yes, sometimes you can just get rid of it on the outside if it's not very bad, but for people who've got severe toenail fungus, it is hard to get rid of. Wet the feet and take a handful of borax, rub it all over the feet to stop itching immediately. So just use borax. Now, this is probably the best treatment that we know, or what I know of, for vaginal thrush. Fill your large gelatin capsule and insert in vagina at bedtime for several nights or up to 2 weeks. Alternatively, the powder can be mixed with cool, solidified coconut oil and used as a bolus or a suppository. So what I would do with that, it's a bit hard. Sometimes it's a bit hard to get in. I would freeze that. It could be frozen. Alternatively, now this is the easiest one. Alternatively, douche with half a teaspoon in a cup of lukewarm water. And that gets rid of borax, gets rid of thrush, just as quick as that. Probably you might need to do it for up to 3 days, if at the most a week. But if you do it specially, and sometimes if you're using the gelatin capsule, you may have to say that you need to wear a panty liner because there is a discharge which can make a woman feel uncomfortable, but it's not too hard. Okay, removes heavy metal and fluoride. Now, this is a huge one. I talked to you a moment ago about the heavy metal buildup. Borax, similar to the equally endangered lugols, can also be used to remove accumulated fluoride and heavy metals from the body. Now, fluoride not only causes bones to deteriorate, but also causes the pineal gland to calcify and the thyroid to become underactive. So who's telling the people underactive thyroid get into borax? Pineal gland. What's pineal gland is your master gland. It controls so many functions in your body. But borax reacts with fluoride ions to form boron fluorines, which are then excreted in the urine. You can use it for fibromyalgia, rosacea, chronic fatigue. Once again, this one's just an eighth of a teaspoon with an eighth of a teaspoon of sea salt. If you forgot your sea salt, that's all right, but just get into your borax. For calcification, and remember, if you've got calcification on your outside, on your heels, you've probably got it on internally as well. In your artery walls, where you've got arteriosclerosis, it could be in your kidneys, where you're getting kidney stones and calcification going on in there. So we can have calcification going on a lot of places in our body. Calcium can accumulate in your cells. This leads only to partial relaxation of the muscles with stiffness, a tendency to cramps, poor blood and lymph flow. Also, look at that, causing cataracts in the eyes. You know, I don't know how many people are coming to me and talking to me about cataracts. So many people are concerned because all of a sudden everyone seems to have cataracts. And I'm saying it's something that's happening around us, because I know a lady who works in the eye clinic, and she said she cannot believe it, how it, from working there some years ago to now, it is just becoming they are getting so busy, they have to expand so much. So many people are coming in with eye problems. Something else other than normal is happening in our world. And I believe that, obviously to me, EMFs, plus all the other things that are happening, but we've got heavy metals, we've got all these things in our bodies. It's a combination. You remember, it's not just one thing. Parathyroids. Now, boron deficiency causes the parathyroids to become overactive. Okay, it says boron is for the parathyroids what iodine is for the thyroid. So we need to make sure we've got boron or borax. And this one, combine it with magnesium. For the elderly, combine it with magnesium, spaced out during the day with protracted joint problems, additional transdermal magnesium. And this is great to reverse tissue calcification. Where do you buy it in Australia? Now, you get it from the laundry and cleaning sections of the supermarket. There is no food-grade borax available or necessary. All borax is the same and natural and usually mined in California or Turkey, whether it has been packed in China or any other country. So borax is pretty fine. Okay, 99% pure is borax is the legal standard for agricultural grade borax, and boric acid, if available, may be used at about 2/3 of the dose of borax, but we can't buy it in Australia. So this is what I buy. That's powdered borax. That's the brand. It's Harper's brand, I think it's called. And firstly, for higher doses, it's 1/4 teaspoon in a litre of water, spaced out during the day. For standard doses, it's either 1/8 teaspoon or a pinch of borax in your water taken during the day. That's it. But, by the way, on there it says dangerous if used or poison if consumed. Well, right. Well, I've been taking it for quite a while, okay. Government health agencies are concerned about boron toxicity, yet it is far safer than table salt. Table salt is 50 to 100% more toxic than borax. It changes the DNA and is mutagenic. While borax is harmless in this regard, yet be sensible and don't overdose. And the last one I'm going to go on to is MSM. It's called methyl sulfonyl methane. And they call it MSM. Okay, MSM is the nutritional organic form of sulfur. Did you see in that word there? Sulfonyl methane? Sulfur. It's sulfur. MSM is sulfur. It is a vitally living, occurring nutrient which is lost during cooking and food processing. It is one of the least toxic substances in biology, with a toxic rating similar to water. But it is vitally needed. It oxygenates the cells, alkalizes the blood. We can need it to produce glutathione, which is absolutely essential for removing heavy metals and many other toxins. What did I just read? Another essential mineral for removing heavy metals. It's a key player in the utilization of amino acids, which are protein, which 70% of which are sulfur-based. Now, what sort of sulfur do we get? The one on the left is organic sulfur. It is not the garden sulfur that you would put on your garden, which is a yellowy one. It is not that one. This one is, you look at it and it looks like very coarse sugar. Very coarse sugar. So that's what it looks like. Tastes pretty terrible too. Okay. But you use it for bodybuilding and repair. It reduces fatigue and soreness after exercise. It helps break up unhealthy calcium deposits in the body. Once again, calcium deposits. And you have to, it's one of the key roles of the most important antioxidants that your body produces for detoxification, glutathione. It's a strong antioxidant. It repairs your nerves, your myelin sheath, okay? Very important for people with multiple sclerosis and peripheral neuropathy. It reverses cancer. It's great for your thickness and strength of your hair. You can use it for acne, rosacea, dry and itchy skin, psoriasis, eczema, dermatitis. Look, it's an excellent thing to have on hand. I just know, when I heard about this, I thought, I need to buy it. This is written by, all this information is written by a man called Dr. Stanley Jacobs, and he's written so much information on it. And it's a precursor, I'll say that, I'll rephrase that again. DMSO is a precursor to this. MSM is derived from trees. It is not a chemical that's some synthetically formed, but it comes from trees. The paper industry used it, found it years ago, and they know that it can actually do all these things, But one of the most important things that it does, it relieves chronic pain. It is a very good pain reliever. And so what they do is they had this Dr. Jacobs, they found there, I'll just rephrase that, they use DMSO is a rawer form of this, but they found when people take DMSO, it leaves a fishy taste inside of their taste, and they usually give it up. They don't like it. So this, they have actually just added an oxygen molecule to this, and it's a much cleaner form of it, and you could take MSM and you take it a lot easier in your body, and it doesn't have, people don't mind it. As I said, to me it's got a very ordinary taste, but I've tasted a lot of things worse. But, it's not hard to get down. It alleviates lung issues. So they found that there's so many things. You use it for diabetes. Sulfur is a critical part of the enzyme involved in the utilization of the sugar glucose. So sulfur is a component of insulin, the protein hormone secreted in the pancreas that is essential to carbohydrate metabolism. So MSM, they've just shortened that long name to MSM. You use it for brain protection. Here it is once again. Many toxic metals accumulate in the brain because the blood-brain barrier has been compromised. A woman who suffered from aluminium poisoning causing severe neurological damage and was bedridden, unable to communicate, took 2 teaspoons of MSM daily along with detox bath, and several months later was leading a normal life again. Now that's from the book. Parasite infections. MSM is an anti-parasitic action against Giardia and all those different worms. I'm not going to read them all. It binds to the mucosa and present a natural blocking interface between hosts and parasites. Okay, it's used for allergies, for autoimmune disorders. Okay, that's it. Where do I get it from? You get it from, and you pick it up from Chemist Warehouse, from any place like that. MSM, methyl sulfonyl methane. So, any questions? We've got some questions here. Just hold on.
Okay, I was just wondering how much you take of the MSM.
MSM you can take up to 8 teaspoons a day. You wouldn't take it all at once, but you'd space it out during the day. You could take 2 teaspoons here, there and 2 teaspoons here, but you space it out. A lot of people said it helps with pain. Very good for arthritis pain. Excellent. Remember, I just said there that it's very good for strengthening hair. A lot of people, especially women, when they lose their hair, start taking MSM and you stop losing your hair. This is years ago when I was going through menopause. I noticed my hair was getting finer and thinner, and I just started taking MSM, and it stopped that. So you need to be males who are bald. I would say I would take it too, but there's a hormone in there too, I guess. Male pattern baldness. I think actually, do you know what? I remember reading one doctor said that it's got to do with some grains. You need to be careful of grains if you've got baldness. Because this fella, he was completely bald, and he says, if only I would have known all those years ago. Any other questions? There's another research, Dr. Stephanie Sehm, she's talking about this too. Huge. We need to realise that we can get loads and loads of... we have to have sulphur in our diet, and we're not getting it. Where do you get sulphur normally? And you get it from your vegetables and your fruit, your cabbage family and all those. There's a lot of sulphur in your cabbage family. Onions, yeah, garlic. You get a lot of them from there. Well, I whizzed through that quicker than I thought I would, but that's all right. Actually, I'll go on to this one. Actually, that's there. The slide is the slide is moved. You know, that's castor oil. What we're doing is we're doing classes, and can I tell you? Just we've got a few minutes left. By far, the most popular class that we have run is a gluten-free bread making class. And we have done that, and one stage here in the hall here, we had 73 people come in for this gluten-free class, bread making. And we knew the moment we did this, it was different from all those classes, because most classes we would get in a similar vein, maybe about the amount that's here. That's normal classes that we have, probably 25 to 30 people. But gluten-free, and I found people ringing up afterwards and they're saying, "Oh, we missed out. Can we book in for next time?" Well, it's not easy just to get everybody coordinated for a next time, but can I assure you that is one program that if you were running and you were organising it, that is something that you need to go look into, because we're doing that. What we do is the gluten-free bread with yeast, a loaf of bread with yeast, a gluten-free sourdough which has got its own culture in, which is beautiful. We also do a life-changing bread, a gluten-free seed bread, and we also do a gluten-free lentil bread. And I tell you what, all of them taste very nice. We do a gluten-free flat bread. So we do lots of different recipes on this. And then we give the people, because Bernice and her crew out there can just put on the nicest setting. They really take time and they set up the table and they do it very nicely. And they set it up and the people have a taste and they could not believe it. Oh, we also did, the first one we did, it was quite a challenge because we had so many people. We also did gluten-free pizza bases, and she had all the toppings on the top of the pizza, so everyone had a slice of pizza, with vegan cheese on it, like a vegan cheese on the top of it. Plus I also do with the lentil bread. You can do a savoury lentil bread, but you also do a lentil bread has a mixture of dried figs and walnuts in it. You chop them up. Oh yeah, well we can send you the recipes. Yeah, so these are the things. Oh, they go down so well. So many of the people really like those recipes. We've had so many people say, especially they taste that lentil, the lentil bread with figs and walnuts, and they say, "Wow, you can't believe all those little slices." And then we have as well on the table, we have all the different breads, and they're all labelled. They've got gluten-free, whatever they were, and this is all that fantastic group out there in the kitchen who we just love. They do this, and then we have all the different spreads. Because as you know, when we're doing a health program like this, there is no way we're going to serve people any margarine or butter. No way. It is totally unhealthy. So we have to show them that we've got something better. We have to show them that we've learned. So we're doing all these spreads. So we think of all the spreads, and you start off with basic hummus, but you do a cashew dip, and you do a pumpkin seed dip, and you can do there's so many different spreads. We can do just one with a better-like butter. We can do a butter-like spread too. So you have all the different ones out there, and people can just come, "Oh, have a taste of this. Oh, this is nice." So that's what we've got. So we've got a really nice team here, and those women in the kitchen are just fantastic. But we teach people we've got something better to offer them. We can't just give them and offer them just basic old margarine or butter. And I keep saying to people, who made the rule up that you have to put butter or margarine on your bread? We've got to teach people we've got something better to offer. So when I'm so disappointed when people offer, we're teaching health and we've got butter on our bread or margarine. I'm just quite mystified that people don't, because most of the people who come from the public, we're doing health outreach for the people. Most of the people who are coming from the public are switched on. They know how harmful margarine is for them. They're not going to, these people teaching health and they're using margarine, it just devalues our health message because we're not showing that we know we've got something better. And you can have nice, tasty food and you can use spreads. And you can get some very good spreads out there. So we invent some more as well. Yes? Yes, actually, that's one of my other talks is detoxing the liver. That's a different. I've got quite a lot of, I don't know what else is here, fungal link. I do GMOs, gluten and the fungal link, a liver cleanse. I've just taken these slides off and I haven't shifted them around at all. Yeah. That was my email. And this one here is these were recorded, and this is what we put on Facebook, YouTube, and Brighteon and Rumble. And the Facebook ones a lot of them have been taken down. The YouTube the earlier ones have been taken down. But Brighteon and Rumble have still got all the old recordings that we did in 2022. So you'll find them there. And they are the same links. I went into the book because I was telling them of chlorine dioxide. And one of the ladies, this was in America, and I said, I've got a link and it's on Facebook. And I told her where to go. And I said, I know it was in 2022, it was August 2022. Just look for the one August 2022. And she says, not there. And I said, it should be. But when I went in to look for it, it wasn't there. She was right. So I went in and I looked in the link in the front cover of my book, down the bottom, you'll see links. And I went to that and it's still active. And I went into Rumble and that's where we've been posting, and Ralph has been posting these and they're live streaming to Rumble and also to YouTube. Are they going, Ralph? Yeah, and Facebook. Not these ones. But we need to be careful because we know that they're going to be taken down because we're saying things that we called medical misinformation. We know that. So what's the point of, yeah. So we just pull back on that one. So we've just done these to Rumble. So they're still on there. Okay, I think we'll leave it. It's lunchtime now, and I think it won't be long. And those special women, we have to be very nice to them because somebody said that be very nice to the kitchen staff and you get extra little things. Now that was Ali yesterday. You said you get extra things if you're very nice to the kitchen staff. Okay, let's just have a prayer before we go. Heavenly Father, we thank you so much for this knowledge. You are so good to us. You've given us simple, practical knowledge that we can use. But we also thank you for how you've blessed us. And we just pray for a blessing on this food, that it will strengthen and nourish us. And Lord, we want to serve you. So please, we just pray for good health so we can serve you. We pray this in Jesus' name. Amen.